Welcome to It's Your Case, presented by VetCT.com. I'm Amy Zalcman, your radiologist on demand for this week. This month's theme is pulmonary patterns. It's time to take a breath. We are going to take a journey, albeit abbreviated, through the four broad classifications of pulmonary patterns. While collectively we recognize that there are the vascular, bronchial, interstitial, and alveolar patterns, there are subcategories within each that may influence the order of radiographic differential diagnoses. It is always important to keep these findings in the context of the patient history and exam. A short commentary will be included after each case about the pattern. Today's example is a 5-year-old female entire Bichon Frise who is coughing this week with increased respiratory effort in the past few days. Additionally, she has been lethargic and has had a decreased appetite. She has had a soft continuous murmur, but that has not been noted before as this is her first vet visit since her puppy vaccines. There is severe global enlargement of the cardiac silhouette such that it spans both the height and the width of the thorax, with severe dorsal displacement of the terminal trachea. The aortic arch is enlarged and bulges at the 12 to 2 o'clock location in the ventrodorsal view. There is a severe generalized hypervascular pattern with predominantly generalized increased diameter of the arteries relative to the corresponding veins. The arteries have a mild peripheral tortuosity. The pulmonary parenchyma generally has an increased opacity as well. The caudal contour of the heart has a normal shape without straightening of the caudal cardiac waist. Although dorsally displaced as previously described, the trachea does have a normal diameter, unlike the left caudal mainstem bronchus, which does appear narrowed. The lobar bronchi taper and have an appropriate diameter. The mediastinum and pleural space are unremarkable. Our conclusions for this patient are severe generalized cardiomegaly with severe arterial hypervascular pattern and a suspected ductus bump. The size of the heart and enlarged arteries are most consistent with a congenital left to right shunting heart defect. This can include a PDA, such as a patent ductus arteriosus, a VSD or ventricular septal defect, or other complex anomaly. Patent ductus arteriosus is the more common of these congenital defects in the dog. The diffuse interstitial pattern is likely due to a combination of the severe hypervascular disease and a component of pulmonary edema is also possible. There is mild compression of the main stem bronchi as well. The generalized enlargement of the pulmonary arteries can also be seen with heartworm disease. However, the cardiac enlargement is more consistent with the volume overload, and in combination with the large arteries, prioritization is given to a congenital cardiac defect with left to right shunting. The coughing could be due to compression of the caudal mainstem bronchus due to the large size of the heart. The enlarged aortic arch resembles a ductus bump, and this is the reason that PDA is included in the differential diagnosis for this dog. An echocardiogram is indicated to further assess and confirm the presence of a congenital heart defect to rule out other causes for the volume overload of the heart. Let's talk a little bit more about the vascular pattern. There is always a vascular pattern. The vessels and interstitium contribute to the baseline opacity of the lungs. When there is less perfusion of the vessels, the lungs may appear more lucent. For example, this may be observed in patients with dehydration or hypoadrenocorticism. The opposite is true as well. When the vessels are overperfused, the distension of the vessels may increase the overall opacity of the lungs. In this circumstance, deep inspiratory image capture is ideal, as this will help determine if the boundaries of the vessels are sharp, meaning that the opacification is coming from the vessels, or if there is less distinction of the margins of the vessels, meaning that there may be concurrent change in the interstitium. If the image is expiratory, there is crowding of the vessels, and this assessment is made more difficult. Be sure to view the full report associated with this case. Thanks for listening, and remember, it's your case, so please post your questions on social media.